Hi, my name's Abby and I'm one of the surgeons at Veterinary Specialist Services. Today I'm going to have a chat to you about patients with spinal cord disease, and this is one of the most common referrals to Veterinary Specialist Services. So these patients can present either with pain only, so pain in the cervical region or back, or they can have various degrees of neurological dysfunction, and that can include paresis or paralysis of one or multiple limbs. And there's various grading systems that can be used to grade the severity of neurological dysfunction that your pet may have. And then the important thing for us is then to ascertain what the likely causes of the spinal cord disease are, and that's called our differential diagnoses list. And there can be lots of different things that can affect the spinal cord in patients. And two of the most common things that can cause compression of the spinal cord from the outside in can be either an intervertebral disc, so an intervertebral disc extrusion, or which is a rupture of the disc contents, or a intervertebral disc protrusion where the outer layers of the disc are bulging and placing pressure on the spinal cord. Or the other possibility that we always need to consider is some sort of a cancer or tumour that could be putting pressure on the spinal cord itself. And we'll be able to gauge the likelihood of that from your patient's progression of signs, signalment and history. The other thing that can be putting pressure on the spinal cord is the bony column itself, and this is usually in cases of spinal cord trauma, which of course we can usually ascertain from the patient's history. Other differentials for spinal cord disease can include inflammatory and infectious conditions, and inflammatory meningitis is actually a condition that we see quite commonly, and it can often present very similarly to a compressive lesion on the spinal cord. So this is often a differential, and the likelihood of this will often depend on the breed and signalment of the patient. And then finally, you can have conditions that affect the spinal cord itself. So that would be things like a fibrocartilage embolus, which can affect the blood supply to a region of the spinal cord, or there can be a tumour within the spinal cord parenchyma, and that can be another cause of neurological dysfunction and spinal cord disease. So our next step is to image the patient, and we have a variety of different imaging modalities that we can use. The first is a CT scan, which is a series of radiographs or x-rays that are taken at different angles, and then a computer software program interprets all of these and can create slices where we can look through the spinal cord, and even 3D images of the spinal column and spinal cord region, so that we can best ascertain the diagnosis. One of the other common imaging modalities is MRI, and that uses a powerful magnet to obtain images of the spinal cord, and it's especially useful for looking at the spinal cord and the brain, and it can give us some really nice pictures of those regions. The other imaging modality that we'll sometimes use in conjunction with either radiographs or a CT scan is a myelogram. And a myelogram is where we inject a little bit of dye around the spinal cord, and this can help highlight lesions that we may not see on the plain scans. Often at the same time as this, we'll collect a little bit of cerebrospinal fluid from around the spinal cord, and sometimes from the cerebrospinal fluid we can look to see how likely inflammatory or infectious disease may be compared to some of the other causes of spinal cord disease. There's multiple different treatment options for pets with spinal cord disease. If there's a disc that's putting pressure on the spinal cord, especially in the more severe neurological grades, then surgery can be an emergency. And what we generally do with those patients is we make a small hole in the bony column or the spinal column, and this is called a hemilaminectomy. A hemilaminectomy allows us to access the spinal cord and clear away any intervertebral disc that may be in the neural canal, and that can allow decompression of the spinal cord. And in most cases, especially dogs that still have pain sensation to their limbs, they will go on to make a full recovery. And we see that in over 90% of patients with intervertebral disc disease. In patients that have lost the ability to feel pain in their limbs, usually these are patients with a pelvic limb or a hind limb paralysis, those patients have more like a 60 to 70% chance of making a good recovery. We define a good recovery as the patient being able to walk and urinate. So there may be some degree of neurological ongoing dysfunction. They may still be a little bit wobbly, but they can still be suitable to be a pet dog at home and enjoy normal life in a pain-free manner. So other spinal procedures that we perform here at VSS can be things such as spinal column stabilizations, and one of the systems that we use here is called the C-LOCS, and this will actually replace a disc and at the same time stabilize two vertebrae within the vertebral column together. And this is something that is for very specific spinal cord conditions, but it is something that we have available to us here. We often also use fluoroscopy to guide our intraoperative decisions, and this is a highly specialized piece of equipment that we can take into our theatres to give us live images of what we're doing when it comes to stabilizing the spinal cord. When your dog is discharged after spinal surgery, we give you some comprehensive discharge notes. In those discharge notes are QR code links to various videos that can help you to care for your patient at home. These videos include how to perform things like passive range of motion exercises, and in dogs with more severe neurological recovery, it will explain how you can express your pet's bladder. All of the medications that they need will also be clearly outlined to you in the discharge instructions. For any further questions about spinal surgery at Veterinary Specialist Services, please don't hesitate to contact one of the team.